Welcome to Sofwave's live webinar. Tonight we're discussing non-invasive full body toning and laxity treatments. I'm Carolyn Grimes and I'm here with Kim Bello. And we are really excited to have Dr. Johnny Franco and Dr. Ann Chapas with us tonight. And I'll start with some quick introductions for those of you who don't know our expert physicians. Dr. Johnny Franco is originally from Las Cruces, New Mexico. He's bilingual in English and Spanish. He earned his doctorate from the University of Texas Medical Branch at Galveston, and Dr. Franco is a board-certified plastic surgeon in Austin, Texas. Also, Dr. Ann Chapas, she graduated with honors from Harvard Medical School, and she's a Manhattan-based dermatologist and a dermatologic surgeon. She specializes in laser surgeries, Mohs surgeries, and cosmetic procedures. And Dr. Chapas is the founder and medical director of Union Derm. So thank you for being here, doctors, and taking the time out of your schedule this evening.
No, this is super exciting. I don't think the timing could be any better. But anyway, we've had a little chance to chat. It's interesting because Ann and I have such different practices, but we have so much overlap. And I think, the whole issue of this weight loss revolution and beyond, we're talking about skin laxity, people's concern for muscle. It's funny how it's brought so many different groups together. And we're just chatting about how much overlap we have even in our own practices, even though where we start with dermatology and body sculpting surgery, we're so far apart, and we've kind of met in the middle here, which is kind of Sofwave and Pure Impact. Talking about the market share stuff, and this is interesting because one of my passions, for anybody that doesn't know, and we'll get into it a little bit, is the weight loss revolution. I've been so excited about it because and I'll share a little bit. I've been personally on the journey. I started the GLP medications myself in October of 2022. At this point, I'm down almost 90 pounds on the medications. I've switched myself what we would call a maintenance dose. So to be one shot every about six months or 6 weeks or so, usually before a big conference when we're going to eat way too many things and enjoy parties with friends from haven't seen in forever. And the idea about this is, there's never been something that has resonated with so many people. And in our practice, we call this a magnet lead because you got this overall market share that has exploded. You have 70% of Americans that fall into this category of overweight, obese. That number is just growing every year. We were talking before this, the GLP medications are only going to expand in terms of this. Our Chapas was talking about that Wall Street Journal, I think, said, 5% of people are on it. We both think that number is underreported. There's been some articles that have talked about it being the new statin. I personally think, this is probably the biggest medication in terms of a ripple effect since penicillin, because you're going to have so many people on this and you're going to see so many different effects. And this is where I think Sofwave and Pure Impact is so uniquely posed, because, the issues of this being there. For our practice, we've seen this from a marketing, from a standpoint. And again, I want this to be super clear in terms of stuff. I'm not telling people on the webinar that you need to be a weight loss clinic. Whether you provide these medications or not in your office, conversation for a different day. But there's going to be people on these medications throughout the country. There's going to be people looking for solutions for these throughout the country. And if you don't have a way to resonate or talk to these patients, you're going to miss out. And I'll share a little tidbit in our own office. We've been updating our own website. As you guys know, it seems like it's a never-ending project in terms of updating some of these things. But just to give you an idea of the market share, when we updated our Ozempic face page, because previously to that, our pricing page was always the number one visited page, which is no surprise. Everybody wants to know what something costs before they come in. When we launched our Ozempic face page on our website, we had over 250,000 views in the first 4 days that the page was up, which just shows you how many people are searching this, how many people have, concerns for that type of thing. So I think there's so many opportunities for people with solutions. And we'll get into kind of how we talk to those patients and how we kind of move them along to some of these unique solutions. We call this the rise of the skinny shop, but this is some of the stuff I was already talking about in terms of the amount of people on these medications, and I definitely hear a lot of times people talking about what do these drugs actually do, what is the effect going to have on these, and a couple of things that you'll see here when we talk about this. The biggest concerns are one, were these drugs gonna stay? I think it's super clear that at this point they're not going anywhere anytime soon. There are so many medications on the forefront, the amount of weight that people are losing, and then the reasons that people are on these medications is continue to explode. Also, I think some of the uses for these medications beyond diabetes and weight loss. I recently did an article for New Beauty where it was the 6 reasons people take GLPs that don't relate to diabetes and weight loss. And we only covered 6, but I think there was about 10 more that we found, and actually threw out another 2 or 3 that I didn't even know about when we were talking previously. So it was so interesting about this. But I'll tell you, one of the things that's been so interesting to me, and I'll see if we can talk Sofwave and Pure back into doing another webinars, how this has rolled into this overall wellness wave. And so, we talk about this, this marketing wave, this soft wave, but you have this overall wellness wave that has been created by patients. And so people wanting to live their fit and fabulous life, people wanting to, make a change. And I think the timing was just perfect from post-pandemic. Most of us put on a little bit of weight. I put on a lot of weight, and then trying to kind of make a transition in their life, and then finding a solution that actually works. And then now, once you feel really, really great about yourself, stuff starts to change. You get excited about things again. So I think super interesting, but also some unique problems, which puts us in a really great spot to help find solutions for some of these things. I hear all the time that, hey, I've missed the boat on this whole Ozempic face, on the weight loss revolution, these type of things. I mean, that couldn't be any farther from the truth. If you take Dr. Chapas' stat of 5%, and I think in unique markets, we probably both agree that's a little underreported. But even if you double that, right, that still means 90% of people aren't on these medications. It means there's so many more opportunities coming, which I think is so exciting. And some of the stats we don't even have here, Wegovy recently released, and this is just Wegovy itself, 27,000 new users per week on this right now still. And that's probably the least used medication when you look at, some of the new ones like Zepbound and the tirzepatide medications. Doesn't include any of the compound medications as well. There's so many new medications coming out in the market over the next several years. Triple G, which will probably be available sometime in 2025, is the way everything's being fast tracked. 25% of weight loss. So you're going to see more and more of this. You're going to see more skin laxity. You're going to see more concerns about muscle mass, which is super interesting because, I've never had patients coming to us asking about how they can, build muscle. A lot of times, most of us have had other kind of muscle building, E-stem stuff, things in our office in the past. And it was always us trying to resonate with patients, us trying to educate them on opportunities. Now we have people coming to us and bringing up questions about how can I preserve my muscle? How can I increase my muscle mass? How can I just maintain what I have? And so I think some really unique opportunities coming to the market and for providers.
Johnny, I'm going to jump in there too, because I've been doing muscle stim for a while, and usually that patient was fitter, right?
Mm-hmm.
Usually your muscle, building patient wanted a 6-pack. They were, or maybe they were already in shape and they wanted to have a better definition. But I think what we're seeing now, as you were saying too, with patients on the weight loss medications, is they're coming in not to get a 6-pack, but to get strong and to not lose muscle mass. And I think that's such an important concept that these patients aren't educated about. A lot of times when they start the medication, it's all about you're going to lose weight, you're going to be healthier, you're going to improve your blood sugar, you're going to improve your high blood pressure, your arthritis, all these great benefits that we're seeing with these patients. They're happier, they're more confident. But I think this whole idea that you're losing muscle mass is been kind of swept under the rug. Mm-hmm. And, I have friends who are, prescribing these medications. Most of them are internists and endocrinologists, and they're now sounding the alarm saying, if you're not doing something to build muscle, you probably shouldn't take this medication.
Don't you think it's interesting? And I would love if you have any tidbits in your office, because you've done so much of this for so long. But I mean, it's almost a different talk track even for us as providers in terms of patients. It's like, to your point, it's not like I'm trying to, be a gladiator tummy stuff here, but it's just I'm trying to hold the line while I'm getting into a better, healthier spot.
Right. And we used to get a lot of people. I've been doing body contouring for over 15 plus years, non-invasively. I've never done liposuction or any of that. Everything's more been, radio frequency, cryolipolysis, injectables, energy-based devices, for body contouring. And now, I feel like people aren't coming to me so much for fat contouring because they're on the Ozempic or the Wegovy, that seems to have been replaced a lot of our fat directed treatments. So really what's built up those body contouring requests have been skin laxity and muscle. And so it's good to have all three, because trends change. And, I think this is if you're doing body contouring in your office, you have to address all three, but one's going down and the other two are trending up.
And I 100%, I think a great point that the next couple of years are going to be a super interesting roller coaster ride of different trends, different things kind of coming. So it's super exciting and probably a little nerve-wracking for most of us. Next slide. This is actually me, and this is a little bit older picture, but that was me 9 months pregnant on the left of the screen there. It's super interesting because if you think about it, I mean, this is my personal journey. I started in October, right after my birthday. It was just decided how to do something, and so made a change. But I think what's interesting here is that, being able to live the journey stuff, it's changed a lot of how I've seen some of the weight loss, how we've talked about in our office, how we've kind of spoken to patients in a way that tries to resonate with them. I also think, it's been interesting because, been able, especially in a plastic surgery office like ours, and you probably get a lot of this too. You have a lot of patients that come in with visceral fat, other stuff that, you just can't get to a good spot. And it's always a little bit defeating. And I always tend to spend more time in consultations where I have nothing to offer them because I feel bad that they pay this fee to come see me and I have nothing to offer them. And now at least being able to do something helps them a little bit.
I think to your point, that's true. I mean, we would get a lot of heavy patients, and the first thing we tell them is you're not a cryolipolysis candidate. Like it's not going to help you. We need to get you close to your ideal weight. So now we do have better options to get patients closer to ideal weight. Your results are completely incredible. I want to hear about your journey. What did you do?
No, it was interesting because I had actually had hosted somebody for a training for a different device that came to visit our office. We were just chatting at dinner. He was telling me about these drugs, and I looked up the New England Journal of Medicine article on Tirzepatide, and I was like, I'm gonna try this myself. And I lost 15 pounds the first month, and we just turned so many people away. We started it on our office. I tracked kind of my whole journey, throughout the first year of doing this. And now we actually see about 2,000 weight loss patients a month in our office through this. But I'll tell you the thing that's interesting, me personally, other than toxin, before I went on my weight loss journey, I had never done any other treatments. Even though I'm in this, I live it every day stuff, just wasn't super, whatever, I was like a lot of the men that come in, just wasn't interested. What's been interesting is the opportunity for how many people this is going to drive in your office that are now wanting to do stuff. Once I started losing some weight and feeling good, I'll let you guys in my beauty secrets. I've done my jawline filler. I've done a little bit of biostimulant in my face. I've definitely done a couple of Sofwave treatments. I've definitely done some Pure Impact on my abs because now I do want to get some gladiator abs. And so I'm going beyond what Anne's saying about just doing a little bit of maintaining. I'm trying to do more. So I'm pushing the limits of how many treatments you can get. So hopefully there's some good before and afters coming soon. Working on my diet a little bit, but it's been super exciting. And there's actually some really, really cool health things coming to the market over the next some are already here, and they're going to be more widely available that are going to help kind of maintain these patients in the office and help them throughout that journey. Next. This is some of it, and one of those is the one in the kind of weird picture in the middle. I shot it because I was a little embarrassed stuff, but it's actually my transition more recently, where I do have a little bit of abs coming. Some of it's Pure Impact, some of it's I've cleaned up my diet a little bit. I've stopped door dashing all the time, and then doing some exercise stuff. But I think this is where we have a real opportunity to coach people along this. I think to really help them through their times, because other than weight, I mean, what resonates with so many people. I mean, most of you that are on here, that getting men into the office is the hardest battle. Once they come into the office, they're like, "Can I do it right now?" And you're like, "No, you can't do your surgery right now." But they're like, "Well, if I come back after lunch," and so it's opened up because Dr. Chapas, you can tell me if you disagree, but I feel like every couple of years in this industry, it's like, oh, men is the new frontier. And we switch out women pictures for males and think that that's all of a sudden going to resonate with them.
Yeah, no, that's kind of been a story since I've been in aesthetics for 20 plus years, is that, oh, this is the year of the men's aesthetics. And, other than hair, and maybe now weight loss, I don't think, this big wave of men are coming in the office. But I think to your point, and this is a trend that we see over and over in aesthetics, is something that's not classically aesthetics, like aging and wrinkles or sun damage, is bringing in a new group of patients. That's someone who's not thinking of themselves as, oh, I'm a vain person, or I'm an aesthetic patient, I'm going to go see a plastic surgeon, a cosmetic dermatologist. This is one of those treatments where I think attracts, everybody. And we're talking about young people, like you're saying, to I've done muscle stim on people in their 80s, because it's so beneficial for patients in so many ways to recover from a illness or surgery, or to prevent falls, to help them just be better at yoga. I mean, it is, I think, one of those interesting treatments that I think attracts a broad range of people: men, women, young, old.
And one of the things we've seen in our office, and you have so much experience at East End, would love to get your feedback on this. It's almost been like a gateway for a lot of our men, because they come in for weight loss, muscle building they can resonate with, like, oh yeah, I'm just getting strong. But then they start to see some benefits, some other things. And now they're a little bit more open to, some skin tightening, maybe a little bit of toxin, maybe other things, because it's kind of bridged that gap. They've gotten familiar with the office. The nice thing about the East End is they got to, kind of come a couple times for their first treatments, and just kind of becomes it a little bit more comfortable situation. Have you seen that? Because you've been doing big in the East End world.
I think we have, and like you're saying, the barrier is just getting people in the door. So I think, to your point, like having a really good website, having videos of the procedures, having patient testimonials, having people who can, in your office, who've done the treatments, who can speak on the phone to patients who are interested, or can tell them when they're in the office, oh, I did Pure Impact, I've done Sofwave, it's really easy, you'll really like it. All those things really help. So, I think that's the most important thing, is, like you're saying, just that barrier to kind of overcoming their nervousness and their fear. Because, like I said, there's a bit of a backlash to some aesthetic procedures, like people being overfilled and people don't want to be looking crazy. And, so I think that we have an opportunity to really create natural, healthier skin for our patients. And that's what we try to emphasize with Sofwave and with Pure Impact, is we're regenerating your own tissue. We're not, plumping you up with something fake.
That's so cool. Next. This is one of the things I'll tell you, if I've had some learning curves and some misstatements that I've had kind of along this, is, when we first started doing the weight loss treatments in our office, I was kind of like a lot of bullish plastic surgeons. I was like, we've seen a bunch of weight loss, we've done massive weight loss surgeries in the past, this is no different. And I'll tell you, I was wrong for the people that we come into our office, because what we've seen is this really, really unique population of very thin, very young patients, more in that mild to moderate weight loss. And I think some of it is self-selected or out, right? So a lot of people that are on the medications for diabetes, most of the people that have multiple things end up somewhere else. A lot of the patients that are in this little bit different category of the 10 to 20 pound weight loss, the super young patients. I'll tell you the thing that's been unique about this, and we'll get into it later, because I do think we're in a super pivotal time in plastic surgery, or aesthetics overall, is this whole Ozempification of aesthetics. And it's this concept I've been playing with, because you see this trend and these changes. You have these young patients, they have their wellness wallet, right? So they've already spending some money. They're maybe a little bit younger, maybe still earlier in their career, but like the old saying goes, and he'll correct me if I'm wrong, because she does a lot more lasers than I do, but if the people who need the treatments the least get the biggest response, right? We've had really young patients, thick dermises, good skin. They have been so responsive. Some of the responses to Sofwave and some of the other energies things have been absolutely amazing. But in the past, we weren't treating 20, 30-year-olds, in my office stuff, we were treating, our 60, 70-year-olds, other people that either didn't want to facelift, much thinner skin, not much dermis, their elastin was limited, to be say the least. I mean, and so they just weren't great, they didn't have a lot of tissue to stimulate, to contract. These young patients with really good skin, I mean, they're so responsive. And I mean, these are home run before and afters, but such a unique patient population. And I think there's going to be some opportunities to really create solutions. I also think for any of the new providers that are on here, these are a lot of spaces that nobody owns, right? Because this is a new era of Ozempic face, butt, breast, body, you name it. And so I think there's some real opportunities to create niches in crowded field stuff. I mean, we can't all, have the prime dermatology practice in Manhattan, which is a feat in itself.
Well, I would say that it's similar to what you're saying there. I mean, I remember the first time not too long ago, I had a consult with a 27-year-old for facial skin laxity. And I told my assistant, you must be out of your mind. What 27-year-old has facial skin laxity? So, but to the point, like she had been on Ozempic and she started to see changes. And so, I think because that people, it's in New York, at least this trend has been going on for a while. People tell friends of friends, hey, I'm on Ozempic too, or you should get it, or this is my doctor, or whatever. The whole concept of, yes, you're going to have some sagging, you're going to have changes in your face, changes in your arms, changes in your abdomen, changes in your buttocks that you don't necessarily anticipate. And so those patients are now being a little bit more proactive, and we're being proactive with them. So as soon as we always update medications and allergies, every patient who comes in the door. And as soon as someone tells me, hey, she's now on Ozempic or he's now on Ozempic, I say, well, we need to have a discussion about like preventing laxity. So we're even like in a preventive discussion, and that, we're trying to prevent that sagging before it happens and build up as much collagen and elastic tissue as they're just starting their GLP-1 journey, because we know that's going to be an ongoing issue. So I just want to talk about skin tightening a little bit, because that is something, that we've been doing for a long time. And that's a trend that just keeps coming. And part of it is that it's a story that just keeps getting better and keeps evolving. And I've been fortunate to be on this skin tightening journey for over 20 years. It started back with the first surgical CO2 lasers, where we really would see, as we're ablating the tissue, this immediate shrinking of the dermis. And patients just got these wow results, these ablation of their wrinkles, this tightening of their eyelid skin, their face, their neck. But it wasn't without significant downtime and full face resurfacing, as well as, potential side effects couldn't be done in darker skin types. So fast forwarding, I'm doing residency in the early 2000s in Boston, and we get one of the first non-invasive skin tightening devices. It was a monopolar radio frequency device. It had a very tiny tip. We did painful treatments all over the face, but it was the first one that showed that increasing the temperature from the skin surface can create collagen and can create this shrink wrapping effect that patients, could see as like a mild tightening. So great for mild and moderate patients. Then we kind of fast forward to the early mid 2000s, and we started to find another way to heat the dermal tissue. And this time we could to target it to different layers of the skin, to kind of, the mid dermis as well as to the SMAS. And that was called high intensity focused ultrasound. Again, pretty painful device, could show some improvement, but, not easy to deliver. You have to visualize what you're doing. So then some smart people in 2009 kind of came up with a device that said, well, what if we took that radio frequency, and instead of applying it on the surface of the skin, what if we put it to the tips of needles, and we kind of drove it, right into that, 1.5, 2 millimeter subdermal tissue, where we know we can create collagen, and we know, it'll get to that right temperature in the right spot and create a pretty good size injury, because these tiny little injuries all over, we're a little variable in what we could achieve. And so this was a unique device. Also, I have in my office. Also, I've had a lot of experience with it, but it's pretty painful. It gets the temperature up to 67 degrees Celsius for 3 seconds. You need 2 meths anesthesia. You end up having, about as much downtime as you would have had with a blade of CO2 or a fractional blade of CO2. So then fast forward to what we're seeing with Sofwave. So this is really a breakthrough that we saw in 2019, where they took all the learnings that we've had along the way, as far as how do we get the right volume of skin to the right temperature at the right level. And in the end, they created a very interesting strategy to increase dermal volume at the right spot to create a reproducible volumizing tightening result on multiple body sites in multiple skin types. And so here's a real-time video of kind of showing how that energy is delivered. Again, what's super important is this is all non-invasive. It's applied at the surface, the skin surface, and that skin surface is cooled because that heat that's generated in the Sofwave could damage the epidermis if we didn't have that important skin cooling. It makes this really unique energy injuries. As you can see, the cylindrical cut of the skin. We have that those little purple dots at the very top there are where that injury is. And that injury is then over time creating elastic tissue as well as new collagen. And really, to Sofwave's credit, and I give them so much credit because I worked with a lot of energy-based devices that get their first FDA clearance, and then they say, oh yeah, you could use it here, you can use it there, you can, it'll be like, cure cancer, like, no, it doesn't, like you really have to do the work and show that each indication in the right protocol, in the right patient with controls can achieve what it wants to do. And so Sofwave at this current time has 8 FDA clearances. They're on their way to get even more. And I think what's interesting and also working in the skin tightening field for a long time is that you can't just take it's very rare to take one device that has good results on the face and just say, okay, well, let's do the same thing on the body. And I have patients, I have a lot of people ask me, doctors, patients are like, well, why can't I just do, the RF needling that we did on our face? Why can't I just do that on the body? And the issue is that the energy that's delivered by the needles is much different than the energy that's delivered by the Sofwave Superb Pulse. You would have to insert 70 needles into the skin with a lot of skin surface damage and a lot of heat to get the same result of injury that we're getting from one pulse of the Sofwave from the skin surface. And the other thing that's really has to hit home here is body skin is different. So it's thicker. We don't have the oil glands that we have on our face. The healing time is always longer on the body. And you think about that, when I zap a little something on the face with a Q-switch laser, I say that's going to heal in about 4 to 5 days. Put a little Aquaphor on it, you'll be fine. If I zap the same spot on the leg with a Q-switch laser, that's going to take a month to heal. So it's just, you got to keep that in mind that you can't just take one device that's really good on the face and then extrapolate it to the body. With the exception, I would say Sofwave has really proven that their device can be used on the body.
And I think being able to treat body stuff is only going to become more and more important with all the stuff we talked about, because you're going to have these young people with a little bit of butt, a little bit of tummy, a little bit of thigh stuff, things. And even as a surgeon, like some of those areas are tough to treat, and the days of like trying to overfill a butt and stuff are gone.
And we see a lot of RF needling patients. I mean, I have RF needling devices that we use on the body. It can go 6-7 millimeters, but unfortunately, some of these patients get erythematous macules from the needles that can last for months. I saw a patient from an outside office who had a treatment done in February, who still had marks on her stomach this week. So, I think it's something to be cautious of because people are doing these treatments to feel better in their body and to look better, and you don't want to make them more self-conscious about something that may be taking a while to heal. Again, just showing some great pictures here. What are we talking about? Controlled coagulation and volumizing the dermis. We're making that thicker collagen. We're making that new elastic tissue. And patients are seeing this as, I kind of call it a shrink wrap effect. It makes a tighter way that the skin hugs around the jawline. I show this specifically to patients, the effect that you can get from Sofwave as compared to filler, which is a more like lifting and sometimes more like line etching kind of result, where we're looking at this for more of a global treatment. And to that effect too, it's a really good treatment to treat a large surface area. So I feel like the more surface area that's treated, the better result. So I don't just do like one area of the cheek. You really want to do like a whole area to create that full cosmetic unit result.
And the combination treatments are going to be so important because when people have worked so hard to lose weight, the last thing they want to be told is, let me fill your face back up, when you work so hard to lose it. So if you're not, and we've all been seeing people walk in that they got way too much filler because they thought, if 5 syringes of filler were great, then 15 would be better to lift those cheeks, all in like one big row like this. And it's just,
And the question I'm getting now, and I'm sure you get this a lot too, is someone said to me, like, filler sticks around forever. And I was like, well, that's not necessarily true, but it depends on where you put it. And, and so there is some concern that, as people are reporting more facelifts and other things, that this filler is sticking around forever. So this whole idea of your body, your own tissue rejuvenating, I think is also one of the big trends we'll continue to see.
Mm-hmm.
And then I was fortunate to be involved in this study where, I also give Sofwave a big shout out because cellulite is tough to treat. It is multifactorial. Skin laxity is a big component of it, but so are fibrous bands as well as fat herniation. So initially, I was a little skeptical of what Sofwave would do, knowing how hard it is to treat cellulite. But I they did a very well-controlled study. It was a double treatment protocol on 68 patients. We treated 4 body zones, and the patients were evaluated by the cellulite severity scale, the laxity scale by blinded reviewers. And at 3 months post the second treatment, we saw 89% improvement in both the cellulite and the skin laxity from the blinded evaluation. 50% reduction in cellulite based on the cellulite severity scale, and 44% laxity improvement based on the laxity scale. So again, we're creating more collagen, more elastic tissue. We're creating that firmer layer to help improve the appearance of cellulite.
And this is something that we've done because, there isn't a lot of penetration, because people tolerate so well. We do it in combination with a lot of other treatments because, unfortunately, the butt typically has a lot of things: skin laxity, cellulite, volume stuff. And so when we looked at our statistics, something like 80% of our buttock and what we call cellulite, because a lot of people refer to cellulite as anything they don't like on the butt and thighs.
Right. Yeah, I agree.
And so 80% were combo treatments, and depending on the size of the dimple stuff, sometimes we do targeted, incision of those septal bands, sometimes, targeted filler, and then Sofwave on top, just because it's so rare. And if you get the 20 or 30 reel with 3 dimples, treat them, because that's perfect for your website. But that is a unicorn rarity in our office.
But Johnny, to your point, and I think that's what's super important. Yeah, they got a clearance, for improvement in cellulite. But I think even at the follow-up picture, and these were people in the trial, that patient would say, oh, but what else can I do, doc? And so I think you have to approach it from the get-go with that multifactorial, like, we need skin tightening. We may need to deal with the fibrosis. We may need to, do some biostimulatory, or even we do like fibella sometimes, so it is, there's not a one and done cure for cellulite. And, but this has been a tool that, I think all cellulite has some degree of laxity, except for that 20-year-old ballet dancer who just has 3 dimples. Like, who I did meet once, and I tried to. Yeah. So next slide. But this is I love this study, because this is another study where I get this question every day: is what can I do to improve my arms? It's usually from the mother of the groom who's about to go to her son's wedding and wants to wear a certain dress. So this is the people that come in. So we're looking at our moms, our grandmothers, our people who are starting to notice this skin changes on their arms. And fortunately, again, they went through the rigor of doing an FDA approved study with 46 subjects, another double treatment protocol. I think we should really hit this double treatment protocol a little bit hard here, because one of the co-authors of the study, Suzanne Kilmer, is a big fan and kind of tells me about it all the time. Is that why the double treatment? Well, that collagen that's created in the first 4 to 6 weeks after Sofwave is a better type of collagen to be remodeled again. So you get even more stimulation of new collagen from a collagen that's already in the remodeling phase. So that's why we do a lot of double treatments on the body. These patients had the double treatment protocol, and they were assessed by the Global Aesthetic Improvement Scale in a blinded review. And at 3 months post their second treatments, we saw 93% improvement of the treated arms, had improvement in the upper arm skin laxity per blinded evaluator, and 93% were improved in their appearance. And I think what's interesting is this is a wraparound treatment. You don't just treat one side or the other. As you can see in these arms, you get improvement on the medial arm, as well as above on the posterior arm, lateral arm above the elbow, which is another area that a lot of patients ask about.
It's so funny that you said mother of the groom stuff. My mom actually just recently had this. I'm not married. I think she's just hopeful that, someday I'm gonna pull. So she's like, I gotta be ready when the day comes.
There you go. And I short sleeve season in New York. These are the first questions I get. So next slide.
Her pictures will be up here soon. She just had her first treatment last week. So we'll see how our arms look.
and this is like the home run patient. I mean, we call this, for lack of better term, of cigarette paper type skin, where it's very crepey, very thin. And I think that Sofwave does extremely well here, because like I said, it's that 1.5 millimeter depth, which is really where they need to create the new collagen. This is also really well tolerated. We do topical anesthetic prior to these treatments, and we blow a forced air cooler Zimmer as we do it. But patients are usually gabbing with us. We're chit-chatting, hearing about the wedding, whatever else is going on. So I just want to, and there's no side effects. So I think that's the other big thing to hit home, especially on body treatments, and where people are, out and about and going back to a lot of their activities this summer, is they really want to we're doing a lot of Sofwave specifically in the summer to improve the body appearance.
I think these are great results, because I'll tell you, in the past, even as a surgeon in the past that didn't have a lot of devices, these are people in the past I would just turn away, because it's like, your options are a big scar down the middle of the arm, and they're like, not interested, and
It's good to show before and afters, you know what I mean? Because if her concern is, well, what about the sagging? Like, yeah, my skin looks better. But so, I think that's where down the road, we'll have some muscle stim, we'll have some other things, or to your point, brachioplasties. So I think, it's good to show what it can do and what it can't do as well. And again, that elbow from the other trial, I think really is nice. Tell me about bellies, Dr. Franco. I mean, I see the improvement in the right above the umbilicus. I feel like this is a place patients always point out to me, usually as they're walking out the door from something else. They're like, what can I do about the skin above my belly button?
I'll tell you, this is a spot that I love, and we've actually started this trifecta combo that we do, and I saw it from someone else in surgery, and we've stolen some of the idea. So, because this is an area that's tough. They come in, she's gorgeous, and to do a tummy tuck or do something that is really hard, I just don't. Lipo's not going to help this. So what we'll do now is we'll actually do like Sofwave. We'll do some biostimulant right underneath that, just to help that skin, add a little volume. And then we'll actually, at the same time, we call it skin coaching, but we'll actually use KT tape if you look at it like a V. So straight up the middle, around for the first 3 weeks. And this is actually a study that we're collecting so we can publish. It has made such a dramatic difference when you do, we call it our skin trifecta. And so when you do all three at the same time and then get them to a good spot, because it's not 100% perfect, but for some people, when their tummy looks so good, that little spot above their belly button kills them. And I tell them, just turning that belly button from a frown, to just open it up makes such a world of difference for them.
I like the taping, and I think, there's, like I said, there's a lot of directional treatment that you can do as well, which makes a difference.
And that is just resonates. So here's an exact example of what we do. So she's doing the Sofwave to it. She'll do a little biostimulant, and then she'll put the taping kind of going around and up. And just the taping alone doesn't make any difference. But if you create some of that scar tissue, some of the thing to set in a good spot, and I'll do it even in surgery when I lipo and do some of the HD stuff with them at the same time. But to your point earlier, people come with certain concerns. We've actually used some of these evolving trends as people are trying to drive more people into their office, as a skin as a lead magnet concept, because I think skin laxity is going to be a hugely searched term. I think people are going to be trying to find solutions for this, whether it's through Ozempic, body, face, breast, butt, or just skin laxity in its own. And I think coming up with solutions and treatment protocols, the double treatment, I think we're only scratching the surface of all these non-invasives and what we're going to do for some of these patients over the next 4 or 5 years. So super exciting. And I think I talked about it as we were preparing for some of this. We do more body skin tightening treatments with Sofwave than we even do face. And a lot of it has to do with our personal practice, but just kind of shows the versatility of what you were talking about earlier of doing some of these treatments. I alluded to this a little bit. I do think it's such a pivotal time in plastic surgery, and I get so excited about this. If you guys can't tell, so I'm screaming into the webinar stuff, but I just think, how often do we get a chance to like write the script for how to treat these patients? How often do we get the chance to come up with protocols for these patients and really be on the forefront of how we're doing some of these? And this is why I love doing some of these, is I meet such interesting and smart people. I feel like I always learn more from these webinars than I share of getting ideas from others. We don't get to operate and work together that often. And, I read your papers and see your Instagram and other stuff, but to actually pick your brain and hear you, it's always so interesting. And I think the combination of some of these treatments with the skin tightening, the muscle building, some of the peptides, some of the biostimulants, I think the unique and right combination of those is going to be something that's going to be such a big forefront over the next couple of years. And it sounds like you do a lot of combination treatments already with
yeah, and I think the biostimulants are a game changer on the body too. I feel like that's something you can use anywhere, and it's really, I think, potentiates the Sofwave procedure as well.
But it'll be super interesting. There's a larger volume skin filler that's coming to the market in the fall that'll actually come in like 14 and 28 cc aliquot stuff. And I think that for like the Ozempic butt, for some of these tummies, I think in combination with some of these is going to be a game changer, because that type of volume we haven't seen in the United States. And so super excited. This is actually a patient out of our office. This is someone who was actually a Green Beret back in the day, so had been super, fit, had traveled and so forth, and now is actually really, really high. But he's like, I don't do a lot of physical stuff anymore. I mostly, do other strategic stuff. And this is him after only his first treatment. He just got his second treatment, I think about 2 weeks ago, and he's already, better than this. So it'll be super interesting. We'll give you some updates. But I tell you again, for men to make such a big difference with one treatment with someone that has minimal downtime, that just isn't interested in having surgery and travels a lot, just wasn't a thing for him. So I mean, for me, this is a huge win. But like you mentioned earlier with the arms being real, right? It's not a replacement for a tummy tuck, but me personally, if my tummy improved that much, I'd be super happy for sitting in the office for an hour.
Yep.
And we did the whole thing that we had talked about. We did the skin coaching, we did the biostimulants, kind of the trifecta, and then we got another round of it, which was cool. This is one of my pride and joys, and something that Anna actually alluded to earlier. We call this our Ozempic face and body prevention and treatment plan. When people come in for our journeys, we actually give it to them at their very first wellness visit, and then tell them these are the things to see. When we made this, we tried to make this to organize our providers. I'll tell you that the biggest benefit probably actually came from organizing our staff. For our office staff to have a clear vision, because most of them, patients would call and be like, oh, I'm worried about Ozempic face. And they're like, oh, we don't offer Ozempic in the office. And you're like, okay. And it's funny because we work so hard to train, and when you listen to phone calls and other stuff, it sometimes hurts you. But, for them to have a clear message, because even if we say stuff differently, patients take it as we're saying different things. Maybe we don't know what we're doing. So when we're all saying the same messages, it's been huge. The other tidbit, if I can leave you with one thing, this was interesting. We in the past hadn't measured, and we have 3 pillars. We're trying to add a 4th, but 3 pillars right now. We have surgery, med spa, wellness. And we actually started measuring each of those conversions from one pillar to the next. In 30 days, when we just gave it a name and we call it completion consultation, and we measured it, the conversion from those pillars doubled in 30 days. Just measuring it and giving it a name. And I think because now it's purposeful, it was an idea, we actually had a real reason, and people actually knew we were measuring it. So a couple kind of cool little tidbits. Hopefully this helps you guys as well, because these are the treatment plans we make in ours. We just made it off of Canva.
So I think now we're finally going to jump into muscle. We've had such a good discussion about skin laxity, and I'm realizing we're supposed to wrap this webinar up in about 15 minutes. So we're going to try to, go through the muscle stim. Again, I was slow to the movement here. I remember seeing this first generation and wondering, like, how does this quite fit into my cosmetic dermatology practice? I've been doing a lot of cryolipolysis, but what does muscle actually do? And this was the first generation high fem. It uses a magnetic wave to make a single contraction. It makes an artificial movement. It can be used on multiple body areas, but each body area takes about 30 minutes. Moving forward, this is kind of where I jumped in the game, where these second generation electrical stim devices came out. The first one, though, was a bit cumbersome to set up. Also took 45 minutes, just wasn't practical to hold up a room for 45 minutes in New York City to do one area and then having them come back multiple times. So then kind of jumping into the third generation, they got better. This is what we brought into the practice during COVID, as people couldn't go to the gyms and suddenly they were interested in doing some kind of muscle stimulation devices. The third generation EMS devices had 2 channels. We could do 4 muscle groups for 30 minutes aside, but we couldn't do whole muscle activation. So patients would spend 30 minutes on their stomach, 30 minutes on their bum, 30 minutes on their arms. So I was really excited when finally I saw this 4th generation device that really improved the capabilities of what we were doing with the 3rd generation. First of all, it's super user-friendly and it's wireless. That was a game changer. I was so excited to finally see a device that I wasn't untangling wires to stick on a patient. The other thing that was really interesting is now it's mimicking real exercises without having to change the placements. And it's doing these plyometric exercises with real-time monitoring as well. And we can do the whole front of the body or the whole back of the body in 30 minutes, which not only is great for my patients who, want to get in and out, it's great for the practice because we're now turning that room over a little bit faster as well. Next slide, please. So innovative approach to muscle toning and why plyometric matters. And this is something, I'll tell you, I'm not a big exerciser. Unfortunately, I exercise for health. I do a lot of Pilates and yoga, and I walk over 3 miles a day just in New York City. But so I really wasn't understanding what plyometrics was until I started to learn more about this device. And it really is something that's known as jump training because it's building muscle through strength and speed. It's really giving this explosiveness to build maximum force in a minimum time. And these muscles, because of the way the electrodes are put on the body, are being contracted in a synchronous manner to really emulate real plyometric exercises like burpees and jump squats and those things. And this, again, they went through all the channels to get their FDA clearance to strengthen, tone, and firm, not only, the whole lower body from the abdomen, the buttocks, and the front and back of the thighs. Next slide. And so again, this is what we're doing. So as you see the front and back plyometrics, you're seeing that the hamstrings are firing, the abs are firing. When we do the back, we're getting the glutes as well as the hamstrings. And again, we're doing all of these things in just 30 minutes. The treatment, as you can see on the video on the top, is really showing what muscles are activating in real time, what that looks like. Patients can do 2 treatments a week for 30 minutes, or, people are busy. A lot of times they can only get in once a week. That's fine too. Next slide. And then, Johnny, I know we were looking at some of these photos earlier. These were patients who were treated with the Forest plyo sessions. What were your reactions to these results?
No, this is great. I've actually, Greg and I are close friends and stuff. So he shared these a few times with me, and actually been super exciting to see this because I think for a lot of us to get a little bit of definition, to tone a little bit of this and enhance what you're doing, I think is phenomenal. I'll tell you from a personal view, I had the first generation e-stim in our office stuff and did some of the treatments. One of the things that was super unique about Pure Impact and I loved is I did start going to the gym, since I started my weight loss journey, and I felt like I was doing a lot of ab workout stuff. It was unique that even after, I thought I was doing a lot of ab workout stuff and doing this, I was still really sore after my first few treatments, which I love because I felt like I'm getting some benefit. The other kind of thing that was super cool about the applicator, the way that it is instead of, you know, being something that's set in one paddle type thing, you can actually flex and really play a little bit with the exact placement, which I think was super helpful, because I think sometimes, depending if you're tall, short, you know, whatever stuff, we've always, in the past, we had a little problems just maybe hitting the muscles or specific areas that people wanted. Some of our people who are truly really fit, and we definitely have some bodybuilders and other people who come in, they have specific spots that they want to target that they feel like they're just not hitting during their normal workout. So if you do have some of those extremes, it's nice to be able to tailor it and tweak it just a
And I think the applicators, what's unique about too is they're small, right? So sometimes, you know, you really can't place them on over bony surfaces. And, you know, with some of our women, you know, who really don't have long torsos, that was kind of a challenge, you know, with the electrical stim sometimes. But with this, I feel like, to your point, we're really getting, you know, the exact muscles and really making sure patients feel that plyometric movement.
And this shows just, I think, and Greg does this really cool videos with the OVO stuff, but I think super realistic to get such a quick result stuff. And I think this is just after the first series of 4, and these are only about a month, 6 weeks out. I think the last time I talked to him, and so these results are typically only going to get better. We've also been able to move some of these things into memberships and other stuff, which I think people are going to be more into, because I mean, like most things, it's going to get better and better if you can continue them on there. And then another way to have people coming through the office throughout their journey and stuff. And a lot of times what's been super interesting, we did an event where, you know, for a month, anyone who had reached their weight loss goal, they got one free trial of the Pure Impact. And I think something like 80% of the people who tried it converted to full package purchase stuff, which just shows that they really felt like something was going on.
Yeah. And I mean, I think that's a great promotion. I mean, a lot of times, you know, people are numbing for an hour for a treatment, like we're numbing for Sofwave on their face. Like, you know, they can try Pure Impact while they're waiting. Yeah. And so, wow, we finally got to the question and answers. Sorry. Like I said, we brought a lot of information here tonight. So
that was awesome.
Yeah, thank you. There's just a few questions, and I think we can get through them really quick. The first one is, how many pulses per arm?
Oh, per arm, it's about
Yes.
150 for the front, 150 for the back.
Okay, got it. So 300 total for
Yeah.
each arm. Do you combine Sofwave with microneedling?
I don't personally. I think they kind of do different things, and also have different side effect profiles. I mean, I feel like my Sofwave patients are generally, and I did like 3 consults today about Sofwave, and it was always, you know, I can't have any downtime. I'm going to this place. I've got this event going on, this, you know, and microneedling as well is usually a multi treatments protocol in my office. And so people like that Sofwave, and most indications is 1 or 2.
Yeah, it's super rare that we do them at the same time. We've definitely had people in the past that had RF microneedling, maybe didn't feel like they got enough of a benefit or wanted something else. And so I think that's been great. We've loved more. If it's just purely like a skin texture stuff, then we'll still do some RF microneedling. If they're really like a skin, you know, laxity issue, then we push more people to Sofwave stuff. Also for us here in Texas, I mean, the nice thing about Sofwave being, you know, safe on all skin tones and so forth is takes a lot of stress off of me as I don't necessarily do all the treatments.
Okay, one more. Are you finding that you can use Sofwave to replace fillers in some patients?
Oh,
Or maybe they don't need as much?
100%. I mean, that's for me. And like I said, and there's a lot of backlash to filler. I had a patient today who was like, in my neighborhood, people look crazy. Like that's, you know, and that's, you know, one of the things I hear every day is that people are going away from this overfilled look. So I usually start with Sofwave. I generally say, look, let's do this. And in fact, I had a patient who has been a filler mind patient. We did filler last summer. We did Sofwave in January. I saw her back today, and I did half the amount of filler that I did for her pre-Sofwave. So I think there's definitely, you know, an improvement in the skin laxity. It's kind of putting things in the right position. And then what I explain to patients is giving me now the opportunity to do a very targeted
Mhm.
filler volumizing procedure, not just plumping you up. And, you know, as I mentioned, people are like blowing a balloon up from the inside with filler, you're just going to look like a puffy mess. You know, we really are using filler more for structural support, biostimulation, as Dr. Franco was mentioned, but really like give it about 3 to 6 months after the Sofwave to figure out how much filler your patient might need.
And that needs to resonate with the Ozempic face patients even more, because they feel like their biggest issue is skin laxity. And if you don't even talk about it, you're gonna lose them. And we actually have really, really worked hard to coach our staff about doing that targeted filler, the structural support, you know, and so that way, you know, we're just filling the spots that are adding structure to face. We're not filling your face. And so I think those things are super important. Awesome that I feel like we're on the right track if that's what you use.
And one person has a question, a lot of questions about downtime with Sofwave. And are you red? Is there downtime? You know, what do they need to do, if anything?
0, 0, 0. I mean, that's what's great about it. That level of that cooling that happens at the surface prevents any significant erythema, swelling that you typically associate with heat-based devices. You know, from really having any you know, side effects when they walk out the door. I mean, patients routinely go back to work, go to dinner that night, do all their normal activities after Sofwave.
Right.
Yeah.
How about maintenance? One question about maintenance. So if a person's had Sofwave, when do you tell them to come back if they're happy with the results?
Yeah, I mean, we're building it into a once a year in my practice. We've had it since 2020. People continue to age. I would say so for that average patient, like once a repeat treatment every 12 to 18 months seems to be the right amount. But the contrast of that would be, I think, for patients who are losing weight, and those patients I would put on like every 6 months, you know, to be more proactive on that.
I think Ann talked about this earlier. You know, if they're actively losing weight, you got to be super clear at the beginning that you're trying to hold the line. If they're losing, you know, plan to lose 60, 90 pounds or whatever, and you just even keep them at baseline in terms of their skin laxity, I think that's a huge win. And so just making sure that if they're on their weight loss journey, because we definitely are, a lot of our Sofwave are people on their weight loss journey because of the nature of our practice. And we'll tell them that you're going to need this throughout your journey, and being super upfront about where they're gonna be, because you can't lose that much weight and think that you're going to get that much better. You know, holding the line, I think, is a huge win.
And you know, I think it's important if you're not doing this in your practice, like, so we're not doing weight loss management in my practice, but we do a lot of skin tightening. We weigh our patients before the skin tightening treatment. So, and we document what their weight was in the office. We don't just say, oh, you know, I think I'm 130. It's like, oh, really? Well, let's get on the scale, you know, like, so, you know, and I think that's also important because their follow-ups might be 3-4 months from now. And if they've lost 20 pounds and they come back and say, oh, that Sofwave you didn't work, I'm got more laxity. It's like, well, you lost 20 pounds, you know, so it's important to document that as well.
And I think one final question. So do you numb the body areas when using Sofwave?
100%, yeah.
Okay. And do you stay in that 3.6, 3.8 range?
Yeah, yes. There'll be a new handpiece coming out soon that we did a second body study with the cellulite, and that's going to have a different range. But for the current model, yes, I would say about 3.6 to 3.8.
Okay. I said that was the last question, but there's one more because I think this is important. They are asking if a patient, they come back right away and they're saying, I haven't seen results. How do you talk to them that they need to wait a full 3 months to see final results?
I think you should have had that you got to be super clear about that talk beforehand, because you're always going to be backpedaling if you didn't. I also think getting really good before pictures is going to be priceless too. So make sure that's super standard. I think to the numbing stuff, make sure you're giving patients enough time to numb as well. I think sometimes, and Anna alluded this, is the office is busy. Sometimes make sure you're giving them enough time to numb so it's a good experience for them, so your provider can be aggressive and do that as well.
And then to you know, I always go back to the science and to the Sofwave studies and just talk about, like, you know, energy-based devices, especially Sofwave that creates collagen and elastic tissue. It's not instantaneous. It takes the body about 90 days to create new collagen. So you're not, and I've seen even better results sometimes at 6 to 8 months. So we take really good photography. To Dr. Franco's point, I think training your staff to take good before and after pictures is super important, but also having that conversation from the get-go. And super, super important. Do not let your patients numb at home. There are way too many cases where patients have had lidocaine toxicity on their way to the office. So make sure that all lidocaine is done in your office.
All right, that's a great tip. And guys, this was so great. We appreciate it. Your insight and your knowledge. This has been amazing.